the device, we want you to try out different foods also, no problem, because that will help you understand what's happening, and this gives you a perfect picture of your sugar levels. You can assess it as per your meals, as per your exercise, as per your stress levels, everything, because when the device is attached to you, you have to note down all activities and everything that you follow in the day. That includes your meals, right from your breakfast, your snacks, your lunch, dinner, mid-meal snacks, anything that you have. Along with that, you got to note down your medicine timings, all medicines that you take, any activity levels that you do, let's say any exercise, or you go to walk, or whatever you are doing basically, and anything else that you find can affect my blood sugar, which you feel okay. Everything has to be timed and noted. There are basically sheets of paper that are given to you, and you have to follow that particular pattern. Secondly, because this is a device that checks your blood sugar levels at a tissue level, okay, that is, it is what does it contain of? Basically, the CGMS consists of what? It consists of two separate things. One is a sensor and one is a recording device. The sensor is a one-time use throwaway piece. It is inserted into just under your skin, and it records your blood sugar. It doesn't record your blood sugar levels, it records the sugar levels at the tissue level. That is, before the sugar enters from your bloodstream into your cells, it doesn't just pass through it. It has to go into the interstitial fluid. From there it transfers into the cell. So it is this gap in between that it looks at. Okay, so whatever levels you are looking at it, the difference in the blood will be a delay of 15 minutes, approximately 15 minutes. That's what the studies have indicated. Okay, so whatever level is there, 15 minutes later actually it will reflect in your bloodstream. A comparison between now supposing, like for instance, you can have a look at a pre-lunch was 80 over here and a pre-dinner was 120 over here. Now if I look at this thing, somebody comes to me with reading like this, I'll say fabulous, great, excellent, I won't do anything for him. I'll say nothing else, whatever your treatment is perfectly fine. Now with a CGMS report, this is what it would look like. It has been seen so many times this way. Because it is recording every 5 minutes, you will get this pattern. It is showing your pre-lunch, which is good, your pre-dinner also, that's good, but it shows a fabulous spike that goes up, again a spike that comes later. Now this is something that cannot be seen using a finger prick method. It will never be seen unless you are ready to do your finger pricks every 5 minutes, which is just not possible. A few more of the graphs. The graphs usually come, these are the basic graphs that we're showing you. There are other things also available, but this is how it actually looks, something that you will understand immediately. This shows you the time from 12 o'clock at night to the next day 12 o'clock. That's 24 hours, it's showing you your blood sugars. Here if you notice, the blood sugars are falling dramatically low, below normal. They're going to hypoglycemic range at night, and the morning it starts climbing up. There is something called as a rebound effect. Many times in the night your sugars fall low. They fall so low that your body goes into something called as a reflex mechanism whereby it has to survive. For survival, it will immediately shoot glucagon. It will pump glucose from your liver and it will throw it out. So if you do a sugar in the morning, you may find it to be very high at times. It will be 150, 200. We have recently have a patient who's having 300 plus sugars in the morning, but he goes into hypo at night. It goes down to 40s and 50s because it goes so low. Your body goes into a reflex mechanism. It must go into survival mode. It will shoot up sugar and get you on top. Now this is seen clearly out here. We know exactly what is happening out here. Now you may say, like, people go into hypo will start complaining of hypoglycemia, but over a period of time your body acclimatizes to high sugars and low sugars. It will show no signs and symptoms. There will be absolutely no sign and symptom unless it goes even below the threshold level, which is your own threshold. The threshold levels are individualized to each person. Somebody's threshold will be 70, somebody's level will be 60. Only when it breaches that threshold, you will start complaining of hypoglycemia, some symptoms. Otherwise, it will not. So you are again in the dark, basically, whether it's really happening or it's not happening. With this particular thing, we know exactly, yes, you are going to hypo, you must go in for some sort of treatment. Anything else? Yeah. Here what we do is, again, these are computerized pictures basically. How they generate it is because you're going to give you, they break it down into 3 different meals: your breakfast, lunch and dinner. These are the major meals that you'll be normally having. So with your past trends, 3 or 4 days, what you're going to have, it will combine all of them and will show you what is happening to your sugars with the meal in relation to a specific meal, like for your breakfast, your lunch and your dinner. Now here if you see, with everything it is rising. With the breakfast, with the lunch and breakfast and lunch, it is a normal, it rises up. At dinner time, it's already high. You know now what's going to happen with your thing. That means I know very well I have to treat the person at the breakfast time, at the lunch time. The dinner, he is already high. I have to get it down before it reaches high at the dinner time. So as a doc, I know what I'm supposed to do now, where I'm supposed to give the medications, what dose I have to change. These are the few of the other things that we can see. This patient's readings were completely up throughout. They only come down at pre-dinner time. That means she was being treated with medicines only in the evening time, which was actually sufficient for her. Remaining all the time, the dose was either insufficient or she was eating more than necessary. The previous thing you can see, it comes to normal, but as soon as the morning breakfast starts off, it goes up. It comes down to normal at lunchtime, again it goes up. It comes down to normal at dinner time, again it goes up. That means whatever medications we have to give her, we have to give it in 3 different doses to control those spikes. Probably 2 doses will not be sufficient for her, because each time she has something, it's spiking up. So the treatment will again vary. Somebody will say, no, I can only have morning tablet and night, nothing in the afternoon. I'd say, sorry, you have to have something in the afternoon, or I have to give a medication that will act in the afternoon also. So accordingly, I'll have to decide on the mode of therapy. This mode of therapy, what to do, is best decided even just looking at this thing. The patient can tell me a number of things like, no, I had this, I had that. No, but your reports do not indicate that thing. Because there are a lot of people who say, no, we don't want to have something in the afternoon. I don't have a tablet. I forget having a tablet. But when you see this thing, you will understand that, yes, I need it. So it is something that even you will be convinced about yourself. Yes, I must have the medication as the doctor has told me. Because this will matter not just tablets, it's also with injections, with insulin. Many people tend to avoid taking an afternoon injection, afternoon shot. They are working, how to do it? No. At times it is a necessity, you must take it. Anything else? You got the thing? Like for this patient, you can see it is at hypo levels at night, right from 10 to 8 o'clock. Patient is absolutely below normal. As soon as the morning comes, it shoots up, it remains high up to that. That means the daytime it's high, the entire night it's low. For this patient, the night dose has to be reduced, the daytime has to be increased. Only then we will be able to control. Otherwise, what happens is that you are treating him at night and he is getting over treated at night and under treated in the daytime. These are a few case studies that have been done, and normally the best way to check out how well therapy is effective is by doing HbA1c levels. HbA1c is the one that most of you all be knowing. Last 3 months it gives you an average blood sugar report. So all our patients who are on this device, basically we check them 3 months later what it was now, and 3 months later what it was after the treatment has been modified based on this reports. These are the normal, a few other blood sugar levels, how they are appearing. Yeah, this will show the one previously. This was a report of the patient that was seen before the therapy started. Therapy in the sense, the modification of the therapy. She was already on therapy. We see the spikes coming in the morning, in the afternoon and at night. We know now the medications have to be altered and we had to alter them. After the alteration, this is what it seems now. Most of the sugars are within the normal range. These are the recent ones. Okay. This is the one. Okay. This is the night time, na? Yeah. Now here, if you notice, the sugar levels keep falling at night. They give you hypoglycemic symptoms. Many of them will not complain of hypoglycemia, but we know very well that because of this hypoglycemia, there are going to be problems. Sometimes there will be some severe problem. See, in diabetes, one thing is very clear. It's better to have hyperglycemia than hypoglycemia. Hypoglycemia is an emergency. Okay, unless you treat it by yourself, because there's going to be no doctor around you. You have to treat yourself, and you must know when you are in hypo. If you're not capable of handling yourself, then it's going to be a dangerous situation. So you must know. Many times at night, this is the commonest problem. You never know what's happening at night. So here we know what's happening at night. We have seen the patient going into hypo. The treatment has been altered, and later on, these are the reports that we've seen. The next one shows you normal reports with a little spike in the morning, which is unacceptable. As I told you, little hyper is acceptable, but hypo never. Most important is how to control your hypo, because hypo is something that you will have to treat yourself. No doctor is going to be there around. Now, when this device is attached to you, it needs a calibration, an external calibration. So, whether you are on this device or not, but as long as you are on the device, you need to have at least 3 to 4 finger prick readings, which will have to be timed, because these readings are then manually entered into the computer, and it will calibrate your external reading with the reading that it has taken itself. Without that, it will not accept your report at all. It has an inbuilt algorithm basically, which will compare what you have recorded externally and what it has recorded by itself. So we need to have at least 3 to 4 readings along with this during the time as long as the device is attached to you. And we prefer to have these readings usually